Have you ever noticed that your hands feel different than they used to? Perhaps you feel a slight tingling, numbness, or even unexplained pain. Many seniors overlook such signs or simply attribute them to age. But here's the frightening truth. These seemingly harmless warning signs can be early symptoms of serious illnesses. Illnesses that could endanger your life if you ignore them. Imagine your hands are like a window into your health. They reveal how well your nerves are functioning, how your blood is circulating, and whether there is inflammation lurking in your body. Scientific studies show that over 90% of seniors do not notice or take typical warning signs in their hands seriously. Yet these very signs could help you detect diseases early, and that is exactly what saves lives. Let's start with the first warning sign: tingling, or pins and needles in the fingers. This sensation is often caused by nerve irritation or poor circulation. It's as if the electrical signal to the brain is disrupted or delayed, similar to a broken telephone line. If you experience this, it could indicate carpal tunnel syndrome, a common nerve compression that can lead to permanent nerve damage if left untreated. The next warning sign is sudden weakness or lack of strength in the hands. Do you have difficulty gripping or holding objects securely? This can be an early symptom of neurological disorders, such as stroke or Parkinson's disease. Immediate action is required, especially if these symptoms occur suddenly. But that's not all. Discoloration of the fingers, such as pale or bluish skin, often indicates circulatory problems. It can be a sign of vascular constriction or even autoimmune diseases, such as Raynaud's syndrome, which can cause serious damage if left untreated. It gets even more worrying. Swelling, pain, and stiffness in the fingers can indicate rheumatic diseases such as arthritis. Many seniors believe that joint pain is simply a sign of aging, but early diagnosis and treatment can significantly improve your mobility and quality of life. Now we need to talk about the most dangerous warning sign: sudden numbness, or complete loss of feeling in one hand. This can be a warning sign of a stroke, which is life-threatening and requires immediate medical attention. These 7 warning signs on your hands are not a cause for panic, but a wake-up call to be mindful. They offer a unique opportunity to protect your health and get the right treatment in time. If you would like to learn more, subscribe to the Clar Vital channel. Here you will receive regular life-saving health tips specifically for seniors. Write us in the comments if you are familiar with or have experienced any of these warning signs. We respond to every post. Stay alert, because your hands may soon be saying more than you think. Many seniors are familiar with the feeling, a slight tingling or even numbness in the fingers, that feels like pins and needles. This is often dismissed as harmless or simply attributed to age. But that is a fallacy. This tingling sensation can be an early warning sign of serious health problems that should not be ignored. The most common cause of such complaints is carpal tunnel syndrome. This is when an important nerve in your wrist is constricted, disrupting the transmission of signals from your arm to your hand. If left untreated, the nerves can be permanently damaged, and simple everyday tasks, such as writing or opening a jar, become a chore. Early detection is crucial, because the sooner you act, the better the chances of recovery. However, tingling can also be a sign of circulatory disorders. When blood no longer flows properly to the fingertips, you feel numbness or coldness. This can indicate narrowing of the blood vessels, which, if left untreated, increases the risk of heart attack or stroke. Raynaud's syndrome is particularly dangerous, causing fingers to turn pale or blue and become painful when exposed to cold or stress. Nerve damage is also sometimes the result of diabetes, a condition that is common in seniors. High blood sugar levels damage the nerves, leading to neuropathies, often starting with tingling and numbness in the hands and feet. Without treatment, severe pain and even paralysis can occur. Vitamin deficiencies, especially vitamin B12, can also lead to nerve disorders. An unbalanced diet or poor nutrient absorption in old age increase the risk. Your doctor can determine whether you have a deficiency with simple blood tests and initiate treatment if necessary. What can you do if you experience these symptoms? See a doctor as soon as possible. Simple measures such as wrist splints, physical therapy, or a change in diet can often help. In cases of circulatory disorders, exercise and avoiding the cold can help alleviate symptoms. You should also avoid smoking and stress, as both worsen circulation and promote inflammation. Small changes, such as wearing warm gloves in winter and doing regular hand exercises, support your nerves and blood vessels. At Clar Vital, we are here to help you keep your hands healthy and flexible with tips and information. Feel free to share your experiences with tingling or numbness in the comments. Your stories may help others. In the next chapter, we will talk about weakness and loss of strength in the hands, how you can get to the bottom of these warning signs, and take countermeasures at an early stage. If your hands suddenly become weaker, and you find it difficult to grasp or hold even simple objects, this is more than just an annoying symptom, especially in seniors over the age of 60. This can be a sign of serious illnesses that can severely impair your quality of life. That's why it's important not to ignore these warning signs, but to listen carefully and take action. Weakness in the hands can have various causes. One common cause is carpal tunnel syndrome, which occurs when the median nerve in the wrist is compressed. In addition to tingling, it often causes muscle wasting and loss of strength in the thumb area. If the syndrome is not treated, the function of your hand may remain permanently impaired. Seeing a doctor in good time and undergoing treatment such as splinting or physical therapy are crucial to prevent further damage. Another serious warning sign is sudden or increasing weakness in the hand muscles, which can be caused by neurological disorders. These include diseases such as Parkinson's disease or an incipient stroke. A stroke often causes unilateral paralysis or severe loss of strength. These symptoms require immediate medical attention to minimize permanent damage. Nerve damage caused by diabetes is also a common cause of muscle weakness. High blood sugar can attack the nerves throughout the body, especially in the hands and feet. In addition to numbness, this diabetic neuropathy also leads to reduced muscle strength and impaired coordination. Good blood sugar control is essential here to slow down the progression. Muscle weakness can also be caused by inflammation and autoimmune diseases. Rheumatoid arthritis, for example, leads to pain, swelling, and eventually muscle weakness due to chronic inflammation of the joints. Early diagnosis and proper treatment can alleviate symptoms and maintain your mobility. What can you do yourself if you notice a loss of strength? First, it is important to see a doctor or neurologist to determine the exact cause. At the same time, regular exercise and targeted strength training for the hands can help strengthen muscles and maintain function. Even simple exercises such as squeezing a rubber ball or grasping small objects can have positive effects. A balanced diet rich in vitamins and minerals supports muscle health. Vitamin D, B vitamins, and magnesium are particularly important for promoting muscle function and nerve health. If you have any deficiency symptoms, talk to your doctor about suitable dietary supplements. Also, avoid overworking and straining your hands. Ergonomic aids or breaks during repetitive activities protect against further damage. At Clara Vital, you will find lots of practical tips and instructions for keeping your hands strong and flexible. Share your experiences with us in the comments. Your story may encourage other seniors. In the next chapter, we will focus on changes in skin color on the hands, what they reveal, and when you should be concerned. Stay tuned. Have you ever noticed that the color of your hands changes? Perhaps they turn pale, blue, or even reddish without you having injured yourself. Such changes are more than just cosmetic abnormalities. They can be important indicators of your health. It is particularly important for seniors over the age of 60 to take these signals seriously, as they can indicate serious illnesses that threaten your well-being and life. A common cause of pale hands is poor circulation. When blood does not reach the fingertips properly, the skin appears pale or whitish. This can indicate narrowed blood vessels or circulatory problems. If you also have cold hands, this may be a sign of Raynaud's syndrome. This condition causes the small blood vessels in the fingers to constrict in response to cold or stress, leading to severe color changes and pain. If left untreated, this syndrome can permanently impair blood circulation and lead to tissue damage. Bluish discoloration of the skin, also known as cyanosis, is a warning sign of oxygen deficiency in the blood. This can be caused by heart or lung disease that disrupts oxygen transport in the body. If you notice that your fingers or hands are turning blue, especially at rest or during light exertion, you should seek medical attention immediately. Early diagnosis can enable vital treatment. Redness on the hands can have various causes. A common cause is inflammation, as occurs in rheumatic diseases. Redness accompanied by swelling and pain indicates active inflammation in the joints, which can lead to permanent damage if left untreated. Allergic reactions or skin conditions such as eczema can also cause red skin. Sometimes brown or dark spots appear on the hands, known as age spots. These are usually harmless and are caused by sun exposure and skin aging. However, sudden or irregular discoloration should always be examined by a dermatologist to rule out skin cancer. What can you do if you notice changes in skin color? Observe the changes closely. When do they occur? Are they associated with pain or other symptoms? Document everything to provide your doctor with accurate information. Protect your hands from the cold and avoid smoking, as nicotine impairs blood circulation. A healthy lifestyle with a balanced diet, exercise, and stress reduction supports vascular health. If necessary, doctors may recommend medication or special therapies to improve blood circulation and relieve symptoms. Claire Vital would like to encourage you to view your skin color as an important indicator of your health. Have you noticed any such changes in yourself or your loved ones? Feel free to share your experiences and questions in the comments. We are here for you. In the next chapter, we will focus on pain and swelling in the hands, how to recognize and distinguish them, and what you can do about them. Many seniors are familiar with the unpleasant feeling of pain or swelling in their hands. However, these symptoms are often dismissed as normal signs of aging. Pain and swelling can be indications of serious illnesses that can lead to permanent damage and significant limitations if left untreated. It is therefore important to pay close attention to these warning signs and react early. One of the most common causes of pain and swelling in the hands is rheumatoid arthritis. This is a chronic inflammation of the joints that leads to pain, restricted movement, and swelling. The disease can develop slowly, with symptoms often beginning with morning stiffness and increasing restriction of movement. If rheumatoid arthritis is detected and treated early, damage to the joints can often be prevented. Osteoarthritis, age-related joint wear, is also a common cause. Unlike rheumatoid arthritis, this is a form of cartilage wear that leads to pain during weight-bearing activities, swelling, and restricted movement. Osteoarthritis can initially be treated well with rest and targeted exercise to maintain joint function. Infections such as bacterial arthritis or gout are also possible causes of acute pain and swelling. Gout is caused by deposits of uric acid crystals in the joints, which can trigger severe inflammation. The hands and fingers are particularly commonly affected. These conditions require prompt medical treatment to prevent complications. In addition to the joints, tendinitis can also cause pain and swelling. This inflammation is often caused by overexertion or repetitive movements and leads to pulling pain, swelling, and restricted movement of the fingers or wrists. What can you do if you experience pain and swelling? First, you should take it easy and avoid activities that make the symptoms worse. Cool the affected areas with cold compresses to reduce the inflammation. Painkillers and anti-inflammatory medications can also reduce the symptoms, but always talk to your doctor before using them. Getting an early diagnosis from a specialist is important to figure out the cause and start the right treatment. Physiotherapy, targeted exercise, and in some cases surgery, can maintain or improve the function of your hands. A healthy diet with anti-inflammatory foods such as omega-3 fatty acids and plenty of fresh fruit and vegetables also supports treatment. Avoid smoking, as it worsens inflammation and makes healing more difficult. Claire Vital accompanies you on your journey to better health and quality of life. Do you have pain or swelling in your hands? Share your experiences in the comments. You may help others. In the next chapter, you will learn how sudden numbness or loss of feeling in the hand can be a life-threatening warning sign and what you need to do immediately. Imagine your hand suddenly going completely numb, as if it had fallen asleep. Only this feeling does not go away. It may be accompanied by weakness, paralysis, or difficulty moving your hand. For seniors, this sudden symptom is not a cause for panic, but a reason to act quickly. It could be a life-threatening stroke, and every minute counts. A stroke occurs when the brain is no longer supplied with enough oxygen, often due to a blocked or burst blood vessel. The hands are often affected because the nerve pathways in the brain that are responsible for movement and sensation in the hands suddenly fail. In addition to numbness and paralysis, speech disorders, loss of vision or dizziness may also occur. The insidious thing about it is that many people do not take the symptoms seriously or misinterpret them. They hope that the feeling will go away on its own, but the longer a stroke goes untreated, the greater the risk of permanent damage or even death. Therefore, if you or someone around you notices sudden numbness or weakness in one hand, call emergency services immediately. The FAST rule helps to recognize the most important signs: face drooping, arms weak or numb, speech slurred, time to act. Getting medical attention as quickly as possible can save lives and mitigate the consequences. Some risk factors increase the likelihood of a stroke, including high blood pressure, diabetes, smoking, obesity, and irregular heartbeat. It is therefore particularly important to control these factors and have regular medical checkups. Rehabilitation is crucial after a stroke. Physical therapy and occupational therapy help patients regain lost functions and cope with everyday life independently. Many patients manage to lead active and fulfilling lives despite the severity of the event. But prevention is even better. A healthy diet, exercise, avoiding tobacco and alcohol, and controlling high blood pressure and diabetes can significantly reduce your risk. In addition, A conscious lifestyle with stress reduction and adequate sleep can protect your heart and brain. Clar Vital would like to encourage you to react quickly to sudden symptoms and take your body seriously. Your hands can help you send vital signals. Do you have any questions or experiences related to stroke? Feel free to share them in the comments. We are here for you. In the next chapter, you will learn how you can maintain hand health and prevent warning signs with targeted exercise and small exercises. Our hands are true masterpieces of nature. They grasp, feel, press, and show us the world. However, many people unconsciously neglect their hands, especially after the age of 60. Targeted exercise is the key to preventing warning signs such as pain, weakness, or numbness, and maintaining the long-term health of your hands. In this chapter, you will learn how you can improve your hand function and enhance your quality of life with simple exercises. Let's start with daily mobilization. Mobility is the basis for healthy hands. Even small stretching exercises can help keep the joints supple and prevent stiffness. Stretch your fingers out one after the other and pull them back gently. Roll your wrists slowly in circles to loosen the joints. You can do these exercises anytime, while sitting, or even while watching TV. Strength training is just as important. It strengthens the muscles around the joints and improves stability. A simple rubber ball or a soft tennis ball is ideal. Squeeze the ball firmly several times in a row and then release it. Repeat the exercise 3 times a day with both hands. You will be surprised how quickly your strength and endurance increase. Coordination exercises promote fine motor skills and help keep the nerve pathways active. Try touching the tips of your fingers one after the other with your thumb and each finger of the same hand, doing this slowly and in a controlled manner. Or pick up small objects such as coins or marbles with your fingers and put them down again. These playful exercises train your concentration and dexterity. Holding and grasping everyday objects is also a natural exercise. Take advantage of opportunities to do this while cooking, gardening, or tidying up. Be sure not to repeat the same movements over and over again, but vary your activities to prevent overexertion. Avoid staying in one position for long periods of time, such as typing on your smartphone or tablet for hours on end. Such repetitive strain can irritate nerves and lead to pain. Take regular breaks, shake out your hands, and change your posture. Diet also plays a supporting role. Foods with anti-inflammatory properties such as omega-3 fatty acids, fresh fruit, and vegetables promote joint health. Also, make sure you drink enough fluids to keep your tissues elastic. If you experience pain or numbness, do not hesitate to consult a doctor. Physical therapists can show you individual exercises that are optimally tailored to your needs. Sometimes special splints can also help to relieve nerves and alleviate symptoms. At Clar Vital, you will find lots of helpful instructions and motivating tips to take your hand health into your own hands. Feel free to share your favorite exercises or questions with us in the comments. Together, we can keep your hands fit and flexible for an active and independent life. In the next chapter, you will learn more about the role of nutrition and how you can benefit your hands and prevent discomfort with a targeted diet. What we eat not only affects our general well-being, but also the health of our hands, especially as we age. Nutrients from food help protect joints, reduce inflammation, and strengthen nerve function. In this chapter, you will learn which foods are particularly valuable for preventing pain, stiffness, and weakness in the hands. Let's start with omega-3 fatty acids, which are found in oily fish such as salmon, mackerel, and herring. These valuable fatty acids have anti-inflammatory properties and can alleviate the symptoms of arthritis, one of the most common causes of pain and swelling in the hands. Studies show that a diet rich in omega-3 improves joint mobility and reduces inflammation in the body. Vitamin C is another important building block for healthy hands. It supports collagen formation, a protein that keeps cartilage, tendons, and skin elastic and stable. Good sources of vitamin C include citrus fruits, bell peppers, broccoli, and berries. Broccoli in particular also provides vitamin K and other antioxidants that protect your joints and strengthen your bones. Vitamin D plays a central role in regulating calcium levels in the body and is essential for strong bones and muscles. As we age, the production of vitamin D through sunlight can decrease, so fortified foods or supplements are important. Vitamin D deficiency is associated with an increased risk of joint problems and muscle weakness. Magnesium is essential for muscle function and nerve conduction. A deficiency can lead to cramps and numbness in the hands. Nuts, seeds, whole grains, and green leafy vegetables such as spinach are excellent sources of magnesium. Antioxidants such as beta-carotene, lutein, and zeaxanthin protect cells from harmful free radicals and can slow down the aging of the joints. Carrots kale and spinach are rich in these substances and should be a regular part of your diet. It is also important to drink enough fluids, as water keeps the tissue elastic and supports the joint fluid that facilitates movement. On the other hand, avoid excessive salt consumption, which can promote water retention and swelling. Some foods, such as highly processed products, too much sugar or saturated fats, can promote inflammation and should be reduced as much as possible. Instead, focus on fresh natural foods that provide your body with strength and protection. Clar Vital would like to encourage you to be mindful about your diet and incorporate the right nutrients for healthy hands into your daily routine. Do you have any questions or tips about nutrition? Feel free to share them in the comments to give other seniors valuable ideas. In the next chapter, we will talk about the importance of regular doctor's visits and what questions you should ask at your next appointment to best protect your hand health. Our bodies change over the course of our lives, especially after the age of 60. Preventive care and regular doctor's visits play a crucial role in maintaining hand health. Many symptoms that initially appear harmless can be early warning signs of serious illnesses. That's why it's important to keep a close eye on your hands and seek medical advice if you notice anything unusual. A visit to your family doctor or a specialist can help identify the causes of pain, numbness, swelling, or loss of strength at an early stage. Doctors have various examination methods at their disposal, from physical examinations and blood tests to imaging techniques such as ultrasound or MRI that can provide clarity. The earlier conditions such as arthritis, nerve damage, or circulatory disorders are diagnosed, the better the treatment options. In addition to diagnosis, talking to your doctor is also an opportunity to discuss your lifestyle habits. Diet, exercise, and medication have a significant impact on the health of your hands. Don't hesitate to ask any questions you may have about your symptoms. Don't worry, there are no silly questions, only important information for your treatment. Prepare well for your doctor's appointment. Write down your symptoms, how long they have been present, and whether they are getting worse or better. Ask specific questions about causes and possible treatment options. If you are taking medication, discuss any side effects that may affect the health of your hands. Specialized doctors such as rheumatologists, neurologists, or hand surgeons can help with more complex cases. Don't be afraid to seek a second opinion or ask for a referral. Your health deserves the best care. Preventive checkups are another important aspect. Regular monitoring of blood pressure, blood sugar, cholesterol, and vitamin levels helps to identify risks early on and take countermeasures. Screening for osteoporosis or joint changes can also be useful for protecting bones and joints. Last but not least, trust between patient and doctor is essential. Find a contact person who makes you feel understood and takes your concerns seriously. Clar Vital recommends communicating all health changes openly and consistently following medical recommendations. Together with your medical care provider, you can prevent symptoms, relieve pain, and maintain hand function. Do you have questions about doctor's visits or would you like to share your experiences? Use the comment function. Your story can encourage others. In the last chapter, we summarize the most important findings and provide you with a clear action plan to keep your hands healthy and mobile for a long time. After all this important information about warning signs, causes, and preventive measures, the question arises, what can you do now to keep your hands healthy and functional? In this final chapter, you will find a clear, easy-to-follow action plan that will enable you to actively protect your hand health and prevent symptoms. Firstly, observe your hands closely every day. Look out for changes such as tingling, numbness, pain, swelling, or skin changes. The earlier you recognize symptoms, the better you can intervene. Do not hesitate to consult a doctor promptly if you experience new or worsening symptoms. Secondly, move your hands regularly. Incorporate simple exercises into your daily routine: stretching, mobilization, strengthening, and coordination. These promote blood circulation, strengthen muscles, and protect joints from stiffness. Even short breaks for hand exercises during the day can have a preventive effect. Third, eat a hand-healthy diet. Focus on anti-inflammatory foods that are rich in omega-3, vitamins C, D, and K, and magnesium. Fresh fruit, vegetables, nuts, oily fish, and whole grains provide valuable nutrients that protect joints and nerves. Avoid highly processed foods, sugar, and too much salt. Fourthly, take conscious care of your lifestyle. Avoid smoking and excessive alcohol consumption, as these factors damage vascular and nerve health. Make sure you get enough sleep and reduce stress. Both are important for your body to regenerate. Fifth, take advantage of the possibilities offered by modern medicine. Don't be afraid to see a doctor or therapist. Take advantage of preventive checkups, diagnostics and treatment options at an early stage. Close cooperation with your medical team is the key to success. Sixth, share your experiences. Talk to like-minded people. Join health groups or forums. The community will strengthen your motivation and give you valuable practical tips. You have the power to achieve big changes with small, consistent steps. Your hands are the tools for your independence, communication, and everyday life. Give them the attention and care they deserve. If you take one thing away today, it should be this: get started, observe, move, nourish, care, act, and network. This will not only help you maintain your hand health, but also improve it for an active, self-determined life, well into old age. We at Clara Vital will accompany you on this journey and look forward to supporting you with further tips and knowledge. Do you have any questions, suggestions, or would you like to share your successes? Feel free to write to us in the comments. Together, we can achieve better health and more joy in life. Stay tuned, stay strong, and give your hands the strength they deserve.